Welcome to our webinar series for professionals.
So, welcome everyone to this webinar on dementia prevention, treatment strategies for brain health. I'm Anne-Catherine, co-founder of Nordic Laboratories and DNA Life, a group of companies that is just dedicated to work with functional medicine, personalized medicine, doing prevention rather than treatment, etc. So all you practitioners out there, you have your login details for the VMS system, and you can always log in, find the tests that we are talking about and supplements that we are talking about, and reach out to us if you need any help. I just want to bring to the attention, at least for those who lives in quite close to Stockholm, then you can consider if Portugal is close to Stockholm or if it's just Malmö in Sweden that's close to Stockholm. But we do have the Nordic conference on the 11th to the 13th of November, where we have some experts coming from the US to talk about mold and toxic exposure, organic acids, etc. So if you don't have anything to do that weekend, please reach out and sign up for that. I'll see if I can share the link in the notes during the lecture here today. But yeah, that was some of a little bit of the boring things that we are recording, of course, and we will send out the recording as soon as we have it downloaded and put together. And then apart from that, the stars of today's show is not just one doctor of homeopathy, but two doctors of homeopathy from South Africa. And I have to say that I'm pretty impressed with the educational level of the South Africans. And here we are talking about two women who have many years of experience working with traumatic brain injuries in Rene Jeannes' situation, and then Debbie, who's been studying under Dale Bredesen. So we really have gathered two experts here with clinical experience and lots of knowledge, and they just really wanted to share this information with you. So, and I was like, yes, let's do that, because we have lots of, it's never too late to learn. So working with functional medicine is this continual quest for being hungry to learn all the time. So that's what's going on here. It's time to learn. It's time to maybe share questions and answers and queries in the chat whilst the presentation goes on. But apart from that, I will let the screen and the stage, as we can call it, be passed on to the stars of the show today. Thank you very much, Rene, and thank you very much, Debbie.
Hello, everybody. Welcome to the presentation on dementia. I'm Rene, and I'll be starting with the presentation today. I'm going to share my slides with you. There we go. Okay, so can everybody hear me? Can I start? Yeah, there we go. So Dr. Debbie Smith and myself will be chatting to you about the prevention and treatment of dementia, and in particular, functional medicine approach. So I'd like to chat a little bit about how Debbie and I met. So Debbie and I have been friends for a very long time, actually about 25 years. And this picture over here is where Debbie lives. Debbie lives in Nature's Valley in the Western Cape of South Africa. And this is where she swims every day and runs in that mountain. And the children in the picture are my children. When we go and visit, they love to spend time swimming in this beautiful lagoon. I thought that I would share that with you. And this is a picture that I took this morning. We live at the foot of Table Mountain in Cape Town in South Africa. So just to highlight that Nordic Laboratories is global, and that we as practitioner support are scattered right through the globe, and the tests are available globally. So We are coming to you from South Africa, but isn't it wonderful how we're all connected? So this is our story about me and Debbie and dementia and how we met and how we got to where we are now. Debbie and I studied together from 1995 to 2000, so we're showing our age. And we became very close friends while we were studying. We worked together in a top health shop in 2002. And it's very interesting that functional medicine was already happening in South Africa in 2002. So we were attending workshops on functional medicine, and Metagenics, which is also known as NutriHealth, was already available in South Africa. And we were already prescribing functional medicine supplementation and incorporating that into our practice. I moved to Cape Town in 2003, and Debbie and I stayed in touch. And I visited her often in Johannesburg, where she was at the time. And she visited me in Cape Town. And we chatted every day about patients and asked each other questions about how we'd approach the case. And we really learned together how to treat patients. In 2013, our daughter was born, and it was a very stressful pregnancy. She actually had a coarctation of her aorta, so she had to have surgery at birth. And this is where it all started. So this is our daughter, the photograph of her. So this was about a month after she was discharged from hospital. So she was actually in that intensive care unit for 6 weeks. And she came home for Christmas as our Christmas present. And there's a beautiful picture of her. And this is my mom and our daughter. So in 2013, our daughter was born in December. And in about February of 2014, my mom went to go and do something for me at the shops, and she didn't come back. And I waited a really long time, started getting really worried. And many hours later, my mom came back and said she actually couldn't find her car. This, of course, was very concerning. And we realized that she was actually fairly forgetful. And I sent her off to a geriatrician, which is a specialist for people over the age of 60 years old. And she didn't do too well on her memory test. When she phoned me with the report back, she said that my mom was actually in the early stages of dementia. And of course, I was in a complete state. And I phoned Debbie and I said, what am I going to do? And this is when I got every book I could find. And I started reading and studying all about dementia and how to treat it and how to halt this. And I asked Debbie to please help me. So the two of us formulated a plan. And in 2018, my mom was scored 100% on her memory test. So this is really positive. And this is how Debbie and I really got excited about treating dementia cases. And from then, Debbie and I have treated many dementia cases and have had very good results. So this presentation is based on the work of Dr. Dale Bredesen, the professor of neurology at the University of California. And he's the author of The Ends of Alzheimer's. It's a very, very good book, and I highly recommend you read it. We used our combined experience of 45 years of clinical practice to create this lecture, to emphasize the most important aspects when dealing with a patient with memory decline or a patient wishing to prevent memory decline. So I highly recommend that if any of your patients have dementia, that you actually encourage their children to start preventing dementia, because it can be prevented. So this is what we'll be covering today: the background to dementia, the 4 types of dementia. Then Debbie will cover the five subtypes of Alzheimer's disease. We will cover the risks for dementia, the cognoscopy and what it is, and then reversing Alzheimer's. So what is dementia? Dementia is cognitive decline where many mental abilities are lost. Patients may experience memory loss, difficulty reading, writing, speaking, following conversation, reasoning, calculating, organizing, and planning. It starts with forgetting names, faces, activities, or events. For example, they might forget where they had attended a show. They might forget that they actually went somewhere. They may forget where the car is parked, like with my mom. They forget where they put things. They can't find their keys. They forget phone numbers. They forget the passwords. And they forget eventually how to prepare a meal, how to wash their hair. Dementia is a devastating disease, but it can be prevented. There are 4 types of dementia. There's vascular dementia, frontotemporal dementia, Lewy body dementia, and Alzheimer's disease. Alzheimer's is the most common and the easiest to reverse. Vascular dementia is caused by reduced blood flow to the brain by multiple small strokes. Frontotemporal dementia is less common and shows changes in behavior, memory problems, and difficulty speaking. Lewy body dementia is fairly common. This results in visual hallucinations, delusions, sleepiness, and flinging limbs in sleep. This is not easy to treat. The background to Alzheimer's dementia. Dementia is believed to be incurable and largely untreatable. It's one of the top 10 causes of death in the Western world and the only one with no effective medical treatment. This is why we need to act. And we need to educate our patients. Current Alzheimer's drugs cannot slow or stop the progression, at most for a very limited time. The reason is that the approach is singular and does not address multiple reasons that cause dementia. It's a fatal, devastating disease. The symptoms include, as I mentioned, loss of memory, the capacity to think, the ability to live a full and independent life. It is thought that it's caused by the accumulation of sticky synapse-destroying plaques made of protein called amyloid beta. The thought has been that if the plaques are destroyed, the disease will be reversed. But patient did not get better by reducing amyloid plaques. They actually got worse. Dementia is unfortunately seen as a single disease. Donepezil and memantine are 2 drugs used to treat dementia. My mom was actually on donepezil for a while, but it made no difference and the side effects were really bad. Donepezil is a cholinesterase inhibitor, and this basically results in higher concentrations of acetylcholine, leading to increased communication between nerve cells, which in turn may temporarily improve or stabilize the symptoms of dementia. So it doesn't work for a very long time. Acetylcholine is reduced in Alzheimer's, but increasing acetylcholine does not slow down or cause dementia. And then the brain also responds by making more cholinesterase. So the drug does not work for long. As I mentioned, there are many side effects to the drug. Then later, memantine is used later in the disease with donepezil, and this inhibits the transmission of brain signals via glutamate. Neither drug treats the cause of Alzheimer's. Coming from a functional medicine background, and I'm sure most of you are also, we know that each type of Alzheimer's needs a different treatment, and each patient needs a different approach and different treatment. Each case is different by different biochemical processes. There's lots of holes to plug, and each patient is different. Alzheimer's can be prevented and in many cases reversed. Dr. Dale Bredesen has reversed over 100 cases. His work proves the first reversals of Alzheimer's and this spans over 3 decades of research. He teaches personalized therapeutic programs, and it's best to address at the mild cognitive impairment stage or the subjective cognitive impairment stage. So if you have a patient in their 40s who are struggling to remember names, it actually is the time to act and start treating. It makes me very sad when people say, oh, it's just normal, it's part of aging, forgetfulness, it's just part of being older. And that is not true. One needs to act and treat the patient as soon as possible. So the ApoE4 genetic variant can be tested. And apolipoprotein is a protein that carries lipids. So ApoE4 is the strongest known genetic risk factor for Alzheimer's. Carrying one ApoE4 from one parent increases the risk of Alzheimer's by 30%. Carrying 2 copies increases the risk by 50% or more. The no copy of the allele gives a 9% risk. This test can be done by doing a buccal swab or finger prick test. This is part of the DNA health test, which we offer. Many other factors need to be taken into consideration, and genes are not your destiny. The genes load the gun, lifestyle and other factors pull the trigger. So it's really important to know one's genetic status. It's important to be aware of one's ApoE4 status from 40 or even younger. This dementia can start in one's 20s. It actually starts quite early, starting with difficulty in concentrating, maybe difficulty in studying, forgetting things, forgetting where one put things, and then getting a little bit worse as each decade passes. Amyloid plaque is the brain's way of protecting itself from injury or infection. So this is really interesting. The patients are wanting personalized medicine and wanting to establish and treat the cause of illness. This is where we come into the picture. This is exactly what we do. There are very few medical specialists that encourage prevention or even have a toolkit like we have. We can identify and treat the cause. Functional testing and targeted supplementation is our toolkit. We've got so much to offer. Alzheimer's disease is characterized by amyloid plaques and neurofibrillary tangles. It's diagnosed by these, but not caused by them. Alzheimer's can be diagnosed by a PET scan or cerebrospinal fluid. Alzheimer's is usually diagnosed on symptoms, for example, memory loss and loss of ability to care for oneself. It is fatal if left untreated. Subjective cognitive improvement causes worsening condition noticeable, which is worsening cognition noticeable to the individual. Even in early stages, the PET scan and the cerebrospinal fluid would be abnormal. An MRI may show brain shrinkage. A friend of mine actually called me yesterday to say that she'd had an MRI of her brain. She'd been experiencing brain fog, fatigue, and severe headaches. And she told me that she must be about 50 years old. And she said that she can already, they noticed quite severe brain shrinkage. That's concerning. And for her, there wouldn't be time to waste. She needs to be treated as soon as possible. And Alzheimer's dementia can last 10 years. It starts off with subjective cognitive impairment, where one starts noticing oneself, that one's becoming forgetful, then mild cognitive impairment. And then if one does neuropsychological tests, they may be abnormal, and then Alzheimer's may follow within a few years. Debbie will now be talking about the 5 subtypes of Alzheimer's dementia.
You just need to unmute yourself, Debbie.
I said, hello, everyone. Let's get this party going. Okay, so what we want to now do is look at the 5 subtypes. And the question, first of all, is why do we want to do it? And the reason is so we can be more focused, because there is 42 different reasons a person's mental health can be affected and their memory. And they estimate that on average, most people have between 10 and 12 different reasons. So we want to focus as much as possible to each individual, because once we know what is it for each individual, we're going to be much more successful in the treatment that we're going to offer. While I'm going to do the five subtypes, I'm going to just do some touch points on some tests Dr. Rene is going to do more detail on the test, but you can kind of tie it in there, and then you've heard it more than once as well. So there's 5 subtypes. Technically, there's 6, but number 1 is inflammatory. Number 1B is glycotoxicity. Number 2 is atrophic. 3 is toxic. 4 is vascular, and 5 is traumatic. So let's look at each of those now in detail of what it is. So number 1, we're going to look at is inflammatory. It's also called hot. So you can imagine anything that creates inflammation in the body is going to inflame your brain as well. This is where we want to look at infections, viruses, bacteria, and parasites. So we want to ask the patient about the gut health. We have heard that the gut is your second brain, and that's why it's critical to understand what the gut is doing, because that will give us a sense of if there is a potential low-grade infection going on. Inflammatory foods, we want to eliminate sugar, trans fats, and gluten. So we want to find out about the patient's diet and how it is. If your body produces the amyloid to fight an infection, that infection in the brain is what's going to cause the Alzheimer's. We want to think of other inflammatory problems. Oral bacteria is critical to understand, and it makes so much logical sense if you think your teeth is right by your brain. Chronic sinus infections, all those things can create inflammation and keep you in a chronic state that's going to affect your brain. We then want to make sure we address the infection once we know what that is. We want to help the immune system, and we want to reduce any chronic inflammation in the body. And as I mentioned, look at dental health. Chronic inflammation leads to Alzheimer's and other chronic diseases as well, and it accelerates the aging. And if your immune system is chronically activated, it's going to attack your own body's tissues as well, including your brain. So as Rene mentioned, when we look at the gene testing that's offered, the main one is the APOE4. But really, it is not the only one to look at, which previously, maybe about 8 to 10 years, we thought was the main important one. There's many other things to consider, but this is a good starting point. And as Rene mentioned, when you've got certain of the alleles, the higher or the more homozygous, the higher your risk becomes of developing Alzheimer's as well. So we want to run a test to understand the risk for the patient as well, because it will guide us into the treatment protocol as well. This is just a summary of the test of the DNA mind, and it's divided into the N that stands for neurodegeneration, M is mood, and A is addiction. So when you look at the neurodegeneration, you can see that how much inflammation can play a role as well. So if a person, for example, doesn't have the APOE4 gene, as in this example, we want to realize, but wait, inflammation can still affect their brain. That is where we should focus on for this particular patient. So what other investigations can we do as well? And it's all the typical inflammatory investigations, your sensitive CRP, interleukin-6, interleukin-9, tumor necrosing factor, and vitamin D. And vitamin D is so important that if you've got a low vitamin D deficiency, you increase your risk by 53%. And if your vitamin D is severely reduced, you increase your risk by 125%. So, I mean, this is significant to understand where a patient is, so that your treatment, again, as I mentioned, is more direct. You also want to understand the albumin globulin ratio, because part of that is how your brain detoxifies. You understand the ratio of your omega-6 to omega-3. Omega-6 creates inflammation, omega-3 is more anti-inflammatory. And then we want to understand what's causing the inflammation. So it could be the viral, but leaky gut could be a big component that can keep a person in this state. Poor diet, lectins, other potential issues, even part of metabolic syndrome could create an inflammatory state. So we want to see if the person's prone for this, what is their risk and how high is their markers to understand how to treat them. This is just a touch point on the essential and metabolic fatty acids, which you can do to see exactly what the person might be needing in their system to help balance them out. So other interventions and principles to help a person if they are from type 1, you're going to give recommendation on supplements, which could be pro-resolving mediators, your omega-3. And if we think about it, omega-3, besides being anti-inflammatory, 80% of your brain is fat, so you want to nourish and feed your brain. Ginger, very strong anti-inflammatory. Pregnenolone, if there is suboptimal levels. Curcumin, turmeric, 1 gram daily. You want to consider for this person fasting, because that can feed the brain as well. MCT oil, you want to advise the person on some exercise. If it's possible for the person, you want to combine cardiovascular and strength training, the combination of it, and high intensity training if that is possible for that person. Sleep is very important. One of the factors that's very underlooked for brain health is sleep apnea. And you can, again, it's so obvious if you're not getting enough oxygen to your brain, particularly at nighttime, you're going to starve your brain from the necessary detoxification, number one, because at nighttime when you sleep is when your brain detox. Plus, if you're lacking oxygen, it's going to create problems as well. And you want to ask about stress as well, because stress can create a state of inflammation. So you want to make sure how stressed is the person, does this need, could this even be the factor that's contributing to them the person staying inflamed. Other supplements you can consider for inflammatory is nicotinamide riboside, magnesium threonate, very specific magnesium that crosses the blood-brain barrier, resveratrol, that's the derivative from the wine, which is SIRT1, pregnenolone, vitamin D3, DHA, and ubiquinol, which is coenzyme Q10. Other supplements, mixed tocopherols and tocotrienols, which is your vitamin E, NAC, B6, P5B, B12, and folate. So you can see there's a variety of different things we've got in our toolbox. We just want to match it to exactly what that patient's symptoms are, how inflamed they are, what is their history, so we can make sure we pinpoint for them how we're going to treat them. We can also look at herbs, bacopa, which feeds the brain, withania, which is an adaptogen, so it can help the person if they're very stressed, turmeric, as I mentioned. And then there's a whole host of other herbal medicine as well, again, depending on the patient's symptoms, gotu kola, rhodiola rosea, if they may be fatigued as well, and they're battling to concentrate. So the goal is we want to resolve the inflammation. That is step number one, because if they're staying in that inflamed state, and remember, some of your patients that will come and see you might have been years inflamed. It's not necessarily a new inflammation. So once we've resolved that inflammation, then you can consider whole coffee extract to help maintain their brain after that. So we want to get all levels that's suboptimal to normal, and then we can also consider with that hyperbaric oxygen chambers, the oxygen, because again, you need oxygen to your brain. One of the things that happens as we age, your body produces less oxygen and you've got less red blood cells. And that's why as we age, we get all these conditions where the red blood cells is not being distributed sufficiently and healing cannot take place as quick as what it could when we were maybe in our 20s or even in our 15s. So oxygenation is very important. And that's why the sleep apnea is a very important factor to consider. Okay, let's go to 1.5, which is glycotoxicity. So glycotoxicity is a part of blood sugar dysregulation. And the problem is with the glycotoxicity is that people crave sugar, and sugar is addictive. They've done MRI brain scans to show if people consume sugar, it lights up exactly the same part of your brain as if you had to have cocaine. So it's very difficult for these patients to change their diet just by advising them. One has to help them break the addiction cycle as well. But the sweetness, it creates inflammation on a different level in the brain. It basically causes part of the brain to shrink. And if you've got the APOE4, it's a very important risk factor as well. So as I mentioned, sugar is addictive. sugar and refined carbohydrates and starchy foods. The insulin keeps the blood glucose levels low. The cells become insensitive to the continuous flood of insulin, and glucose also attaches to the proteins and interferes with functioning. And when you measure the patient's HbA1c, it actually alters the molecule. So when you're doing the test to see if the patient's, not just if they've got a blood sugar problem as in diabetes, but also do they have, again, the start of it, what is happening with the insulin fasting and the HbA1c. So the key is we want to restore insulin sensitivity. And for me, the way to do it is normally a three-pronged process for blood sugar. Number one is diet. Mild ketosis, again, you have to look at each individual patient, because some patients do not well on fasting. You want to exercise, that's the second part, and you want to implement supplementation to help. Fiber is very important because that can help the blood sugar to stabilize, soluble and insoluble fiber. You want to look at protein for the patient, but again, you're going to look, is their gut digesting what they are eating as well? And just interesting, metformin, which is used to regulate blood sugar, can create an increase in AB peptides, and this negatively long-term can affect the brain again, the health. So the insulin must be degraded after it has reduced blood sugar, and it's done by an enzyme, insulin degrading enzyme. So insulin degrading enzyme helps regulate your blood sugar, but the other part that it does, it helps to break down the amyloid, the plaques in the brain, but it can't do both at once. So if this enzyme has to function and it's got to work on keeping the blood sugar constantly regulated, the amyloid in the brain cannot be broken down. And that is why it's critical to get the blood sugar correct. So chronically high levels of insulin increase your risk of Alzheimer's. So what do we want to do? Reduce insulin resistance, restore insulin sensitivity, and reduce blood glucose levels. So there's many approaches we can use to help us. Berberine, cinnamon, you can tell the patient to put some cinnamon in the mornings in water. It's going to help balance their blood sugar. If they've already got some signs of blood sugar disorders, particularly if they start getting peripheral neuropathy, alpha-lipoic acid, biotin, glucomannan will balance the blood sugar. Chromium will reduce the craving of sugar. And most of these patients tend to be zinc deficient as well. So the interesting thing about the glycotoxicity is that this is one of the easiest of the subtypes to treat if your patient can be very compliant. And I had just the other day a patient who the diet was changed and we haven't even started going into anything in more detail, and the patient's memory has significantly started to improve already. And this is maybe where you hear the new buzzword. They say, yes, Alzheimer's is diabetes 3, but that's only this one subtype. It's not for everyone. Okay, let's look at number 2, which is atrophic. It also is cold. So you can imagine it's the opposite to that hot inflammatory number 1. And this is where we want to look particularly at hormones, what effect hormones has got on the body. We'll notice this type is much in older people, often 70s or even 80s. It strengthens the synapses to avoid amyloid deposition is critical. So if you imagine your nerves in your brain, they want to get together and they want to fire and they want to talk. But if you've got this gunky amyloid plague in the middle, the nerves can't get to each other, and that's going to affect the memory. So the way we strengthen it is helping the hormonal function and how we can feed the brain. Brain-derived neurotrophic factor is a very important part of this as well, because you want to strengthen the synapses. Now, some people think this particular thing, brain-derived neurotrophic factor, tends to be much more important for some people than other people. And if this comes up, if you do the DNA Mind, for that person, exercise is quite critical to help them to increase the nitric oxide, which will help feed their brain. So you want to look at hormone testing for the atrophic one specifically. So again, if you've got the APOE4, 2 copies, it's going to increase your risk. As I mentioned, the symptoms, it's much later in life that it comes up. When you test a person for the inflammatory markers, you will see that it's usually normal or it might even be low. So remember, when we speak about hormones, we speak about thyroid, adrenal glands, estrogen, progesterone, testosterone, and pregnenolone. Vitamin D is also a hormone, so we want to keep that in mind. What is happening with insulin? It can be linked to atrophic as well. And what's happening with homocysteine. So we want to be careful for these patients with fasting, because you can imagine, as the word says, cold, they're a little bit more contracted, so they need to be nourished more. So cytocholine and DHA can help with the synapses, and you want to restore insulin sensitivity if there's a problem there. This is just, again, a touch point on the Dutch test. And this Dutch test is Rolls-Royce test of all the tests available. And you can see that you not only can you test for the hormones, you can test for the metabolites as well to understand what is happening in the body with each hormone. So what do we want to do? We want to correct all deficiencies. So once we know exactly what the problem is, we want to also consider, in some patients, we mentioned it's usually the elder patients that get it, but there is some exceptions, particularly if a female has a hysterectomy and they remove the ovaries and they push her into menopause, essentially. Those patients can even double their risk for Alzheimer's. So we've just got to remember that one caveat that can sometimes happen for atrophic. Type 3, which is toxic and vile. Now, when I hear the word toxic, I immediately think we all live in a very toxic environment. So most likely, some of us are going to be prone and in type 3. And as I mentioned, there's 42 different reasons people can develop dementia and Alzheimer's. Between 10 and 12 is different factors that affects all of us. So let's see how much of toxic plays a role. So the symptoms start much earlier, late 40s to early 60s. It can also follow if there's great stress. The person will have difficulty organizing numbers and speech. Later, the memory will become more severe, more recent and old memories. They can also, so all the memory can be affected, not just recent memories. It infects the entire brain, not just the hippocampus. It causes the brain to shrink. There's neuroinflammation and it causes vascular leak. Now, 15 to 20% of Alzheimer cases tend to be this. So, I mean, it is quite high. Things to remember for patients that might fit into this category: people who generally get sick when they're very young. And it's more common in women, 50s, and if they're close to menopause as well. So as I mentioned, the age is earlier. Depression is a common symptom. We've got to think of any kind of exposure of toxin that the person could have. It could be mercury, mycotoxins, limes, surgical implants, formaldehyde, toluene, DDE, even EMF. And these people tend to be very sensitive to stress as well. So what do we want to do? Obvious, we want to eliminate toxins. But again, we want to discover what is it for that patient that is what they exposed to, what we need to eliminate. Again, as I mentioned, do they have mercury fillings in their mouth? Is that something we need to consider? Have they been exposed to mold? What is their dental health like, the dental bacteria? And the amyloid binds with these toxins and it prevents them, and it damages your neurons. So we want to make sure we eliminate. Some factors that we can consider is filtered water, sauna, cruciferous vegetables, glutathione and sulforaphane. Anything that works on your phase 1 and your phase 2 of your liver to help it to process, to eliminate the toxins, plus addressing the specific toxin that is affecting that person. You want to remove the source. You want to detoxify phase 1 and phase 2. And we must remember mold, because it is quite a common occurrence that can affect the body as well. Snapshot, there's the mycotoxic profile. This is really just a snapshot. That report has got a lot of more detail in it as well. Chlorella can detoxify. You can even do probiotics for the nose and sinuses if they've got chronic sinus problems, and you want to remove a pathogen. So now you can already see that type 3 and type A can sometimes be similarities in some of them. So if a person maybe got inflammation, you want to make sure you test for that as well. Type 4, more than halfway there, is vascular. So if you think about it, your blood vessels through your whole body, obviously, but it's going to affect your brain as well. So the type of patients, the way you will treat these patients is as if they've got a cardiovascular disease or risk. So you want to understand what the cholesterol levels are, not just the good and bad cholesterol, but you want to understand the density of the molecules as well. And is it oxidized? Because if you're going to get hardening of your arteries, the blood is not going to flow effectively. It's going to affect your brain. It's said that most of these patients, you want to try and avoid statins as much as possible, because statins, again, is going to affect your brain health. It essentially nearly shrinks your brain. You want to look at diet, exercise, stress reduction, your sleep, and also what you're going to do for your LDL. You want to increase nitric oxide, because that is what's going to help send that oxygen into the body. And again, exercise is very beneficial for it. Beetroot can also be used, and arginine. There may be a role for ginkgo, but remember, it can thin the blood. So you've got to be cognizant if your patient is perhaps on any blood thinners. And again, you can consider hyperbaric or exercise with oxygen as well. Touch point of a 2 test, the methylation profile, which is part of the homocysteine and the whole pathway. That's the left one, and the one on the right is the cardiometabolic profile, where you can look at not just the cholesterol markers, but also on the insulin and your high sensitive CRP. The last one is traumatic. So this is patients who had an injury to their head. So even if you've got an injury to your head when you were a child, or let's say maybe football players, they get a lot of injury on the head. That head trauma can significantly increase your risk in later life for dementia and Alzheimer's. So if someone's got a concussion, you want to make sure you treat it quite aggressively at the time they have it, to not prevent any long-term effect later in life. So for these patients, you want to consider, again, hyperbaric oxygen or exercise with oxygen. You want to make sure you let this patient do a lot of brain training and rewiring. May it be crossword puzzles or something where they use their brain a lot. You want to avoid any further head trauma, even mild. And for these patients, there might be a role for stem cells. And that is the 5 subtypes in a very nutshell, but I hope that can guide you to understand your patients, where they've come from, and where you can start focusing on for each patient so the treatments become more specific. And now I'm going to hand over to Rene.
Thank you, Debbie. Seeing how I just need to share my screen. Okay, here we go. So, what is a risky lifestyle for dementia, and how can one actually create dementia? So, these are the risk factors: working late at night, late night snacking, especially sugar, resulting in high insulin before bed and while sleeping. As Debbie mentioned, the risks of having high insulin levels while one is sleeping. Not managing stress and rushing. This causes increased cortisol, which damages the hippocampal neurons. So this causes long-term stress, which can cause neural damage. High glycemic or inflammatory foods can cause insulin spikes and also causing gut damage. Medical drugs, for example, proton pump inhibitors, can affect the absorption of nutrients, for example, zinc and B12 and magnesium. And statins increase the risk of brain atrophy. Not fasting long enough between meals, so people that eat all the time are definitely more at risk because of no autophagy and removal of amyloid plaques. So fasting heals the brain. Lack of exercise, lack of oxygenation to the tissues. Head injuries, which cause shrinking of the brain, loss of neurons and connections. Low sun exposure, which causes low vitamin D3. And D3 forms scaffolding that supports the neurons. Smoking, causing lack of oxygenation and toxins. And not flossing, which causes bacteria in the mouth, which can affect cognition. There's also a link between patients who have had extensive dental work and also dental implants and dementia. A leaky gut can cause a leaky blood-brain barrier, which then causes toxicity, mold exposure, and not enough mental stimulation. This also includes socializing. So this is how we approach the case. And I would encourage all of you not to be afraid, to just jump in and start treating, because approaching dementia or Alzheimer's patient is the same as approaching any other patient. When you have a functional medicine approach, you can't go wrong. And with these kind of cases, we need to just start, because if we don't start treating, we will never learn how to manage these cases. So my first dementia case that I treated, I was really nervous, but it's important to chat to our colleagues and brainstorm the cases. And eventually we do get the experience and we'll become confident in our prescribing. So this is how we approach the case. We take a full history, as we would with any other patient. We would do a full physical examination, a memory test. We would assess past blood tests up to 24 months back. So we actually want to see the trend for this patient. Assess past MRIs and reports. And then once we've done all of that, then we will start with our plan. So we will order new tests. We do the basics, and then we'll start with the gut and advance from there with other functional testing. So by the basics, what I'm meaning is checking for inflammation, doing a basic thyroid test, doing a cholesterol test, checking kidney function, liver function, hormones, possibly B12, folate, magnesium, and then we will take it from there. I do recommend referring to a geriatrician for an assessment and an annual checkup. So a geriatrician spends the first time with the patient 2 hours and they examine them head to toe. They would do an ECG, and of course they are trained, and they also would then be able to determine what kind of Alzheimer's or dementia the patient has. And this will help you with the treatment protocol. The questions to ask a patient would be if they have a history of head trauma, have they fallen, have they hit the head, have they ever been concussed? Have they lost consciousness? Ask them about their diet, about processed food, trans fats, simple carbohydrates. Are they eating an inflammatory diet? Do they consume much sugar, alcohol? Because all of this causes vascular damage and insulin resistance. Ask them about their lifestyle. Are they exercising? How stressed are they? How stressed have they been in the past? Have they had stressful events in their lives? Sleep quality, what time do they go to bed? Are they able to fall asleep easily? Do they stay asleep through the night? Do they wake up in the night? What time in the morning do they wake up? How are they feeling when they wake up? Ask about family history. Is there Alzheimer's or dementia in their family? How are their parents' memories? And of course, this also covers family history of cardiovascular disease, thyroid disease, and so on. Asking them about toxic exposure, for example, general anesthetics. How many anesthetics have they had? How did they feel? How did they tolerate the anesthetic? This will give us clues on imperfect oxygenation. Check their blood circulation. Actually feel their feet, feel their hands, feel their skins. Ask them about dental amalgams and high mercury fish. What fish are they eating? Ask them whether they use chemical body products. What kind of shampoo do they use? Body wash, body lotions, makeup. Are they using toxic makeup, or is it more of a natural? I usually give my patients a list of brands that are less toxic than others to use. I'll give them the exact shop where to buy everything. Ask about perspiration or sweating. Do they perspire easily or not? That gives you a clue on toxicity. Constipation, are they constipated? Because obviously that will increase toxicity. Are they dehydrated? Do they drink enough water? Ask them to expose their lower leg. Look at the skin. That's a very good clue on whether they're dehydrated or not. Ask them how many glasses of water they're actually drinking in a day, and encourage them to put a big bottle of water close to them and encourage them to finish a couple of those in a day. Ask them about their medication list, all the drugs and all the supplements that they're taking, whether they've ever used street drugs, how much alcohol they're consuming on a day and a week, and ask them about smoking. Ask them about oral hygiene. How often are they actually brushing their teeth? Are they actually flossing? So it's best ideal to floss their teeth 3 times a day and brush their teeth 3 times a day. Whether they have surgical implants, and this can cause toxicity. Ask a history about liver, kidney, and lung and heart disease. Ask them about chronic sinusitis and mold exposure. And ask them about the gastrointestinal problems, whether they're bloating, recurrent diarrhea, leaky gut. The use of proton pump inhibitors is really important. And some patients, I'll ask them for their list of medication that they're on, and they will forget to put in an antacid because it's not something that was necessarily prescribed by the doctor. So it's also important to know about what they're buying themselves at the health shop or pharmacy. And ask them about the history of tick bites. Once you've taken the history and examined your patient, you've sent them for, or you've had a look at what tests they've done, and maybe you've now given them the blood form that you want to send them off with, or you've ordered them some tests through Nordic, then you also want to be doing a memory test. This is something that you can download off the internet and you can do in your own rooms. It's not something that you have to refer to a specialist to do. Of course, if you are referring this patient to a geriatrician, they would obviously do a memory test there. But what I recommend you do is do one in your own rooms. And then when you send them off to the geriatrician for a full thorough checkup, send them with a referral letter so that they get referred back to you, and also that you get a report from the geriatrician. So establish a relationship with a geriatrician in your area. So the marker test is the one that I use in my practice, and the patient gets a score out of 30. The normal is 26 to 30. 19 to 25 is associated with mild cognitive impairment. 19 to 22 is when it affects the daily life and it is dementia. And Alzheimer's patients will generally score less than 19. There is also the MSSC. It's a less sensitive test, but it is also one that the practitioners do use. And this is what the marker test looks like. So the patient will be asked to draw a box. They'll be asked to draw patterns. You might hide a couple of art items in your practice and then show them where you've hidden them. And then after a couple of minutes, ask them to point out where they are and what they hid where. So this is a really worthwhile test doing for your patients. Then we would also send a patient, if we are suspecting Alzheimer's or dementia, you as a practitioner, or you may refer to the geriatrician, and if the geriatrician feels that it's necessary, they will send for some imaging or the withdrawal of cerebrospinal fluid. Then MRI would show parts of the brain which have shrunk or which are using less energy. So you can see in the picture over there what a healthy brain looks like and what a severe Alzheimer's brain would look like. If there is a genetic predisposition to Alzheimer's or dementia, then a patient should consider having an MRI done. So if their mother or aunt or uncle had dementia or a grandparent, it's definitely worthwhile doing. Then there is a PET scan, and this can distinguish between the different types of Alzheimer's and would show amyloid plaques. And then the cerebrospinal fluid will also show evidence of amyloid. So when patients reach about 85, it's good to send them for cognoscopy. So generally speaking, specialists would send for a colonoscopy. We would send for a cognoscopy or do a cognoscopy on our patients to establish what their risk factors are and potential contributors to dementia. So we'll do some tests for them. We'll check out their hormones, inflammatory markers, brain nutrients or deficiencies, and toxins. And then you need to establish whether you're looking at prevention or reversal for this patient. So if they find that there is Alzheimer's or dementia in their family, you know that you really want to prevent Alzheimer's, and this is really important. But following an Alzheimer's prevention program would certainly be preventing many chronic diseases, for example, cardiovascular disease and even cancer. So this is how we evaluate the patient with regards to testing. We will evaluate their sleep, ask them generally, as I mentioned, how well they are sleeping, what time they go to bed, do they wake up, what time they wake up in the morning. Then we need to evaluate the ApoE4 status and other genetic tests. So I really like the DNA Health, and Debbie mentioned the DNA Mind. They're both absolutely brilliant tests to do. And I think it's a no-brainer to start with this test to know what the patient's status is. Then we need to establish the nutritional deficiencies. So the metabolomics or the NutriVal are lovely tests to do this. They're our organic acid testing, which we do at Nordic. And this can establish whether this patient has nutritional deficiencies and what to prescribe to actually fix those. Then the zinc copper ratio is really important to do. We also have this test. We need to establish whether this patient has been exposed to toxins. So we could do a heavy metals test. The toxic exposure will also come back up in the metabolomics and the NutriVal. We need to establish how inflamed this patient is. The metabolomics and the NutriVal are really good for this. And as Debbie mentioned, the cardiometabolic profile is also very, very good for inflammation. Then infections, we need to establish past infections for this patient, or whether the patient has a current infection. So it's useful to test for herpes simplex. We have the herpes ELISpot, the Borrelia, which can be tested on our TicPlex Plus. We do have more than that. There are other ways of testing, which we do have at Nordic. And then the gingivitis bacteria, and then fungi. I like the GI map as a stool test, but we have many stool tests. Then with regards to homocysteine and methylation, we can evaluate that by using the metabolomics or the NutriVal. And then we have the methylation profile, which Debbie showed you just now. We need to evaluate fasting insulin. So at Nordic, we have the blood spot HbA1c, and then also the blood spot insulin and HbA1c. With regards to hormone testing, we have the Dutch test. We also have the thyroid test. We have many thyroid tests. And then with regards to toxic exposure, if you're wanting to test for heavy metals, you could be looking at the toxic metals urine test, or the mycotox, which would look into mycotoxins. And then with regards to assessing the immune system, we have a test called the complete blood count, which would show us what the white blood cells are looking like. And then, of course, the GI map would show us how the immune system is looking in the gut. The microbiome can be assessed with the stool test, the GI map, the CSAP, the GI360. We have so many stool tests that one can consider. And then the blood-brain barrier, one is looking at stool tests because leaky gut, leaky blood-brain barrier. We also need to evaluate and investigate the BMI. That would be on examination of the patient, and then consider the MRI volumetrics. It's a simple addition to an MRI. And then you apply targeted treatment once you have all of the information together. Of course, one doesn't necessarily have to run all the tests. And also, because of cost, one can run one and then start treating, like unpeeling an onion. We start treating layer by layer. So you're ordering the most important test first, and then as you work with the patient, one can then plug all the holes. Evaluating sleep is really important. But this is very powerful to prevent Alzheimer's. And most of my patients that I have seen with Alzheimer's or some form of dementia have struggled with sleep. So when one is sleeping, the cleansing of the brain and the extracellular space of the brain expands during sleep, which allows calcium and magnesium ions to flow through. This results in reduced formation of amyloid. Fasting improves insulin sensitivity. So it's best to wait 3 hours after supper before going to bed, and also not eating sugars, especially at night. Autophagy occurs when sleeping, which results in mitochondrial repair and cellular health. Growth hormone increases when one is sleeping and repairs cells. Sleep deprivation increases sugar cravings, and so does eating unhealthy fats. So this is our DNA health report, the DNA health test, and this is a sample report. And the DNA health will enable us to evaluate genetic SNPs for testing. So on this test, one would be able to look at the ApoE4 status of the patient. One can look at the genetic predisposition to methylation, the patient's genetic ability to detoxify, looks at inflammatory SNPs, looks at oxidative stress, and looks at the mitochondrial functioning. This is a really, really easy test to use, and I find the report very easy to use. And what I love about the reporting with Nordic is that the patient can actually understand the report as well. So if you haven't ordered any of our DNA tests, don't be afraid, because they're not difficult to use. They are very, very easy to explain to the patient. And we also have support team at Nordic that will help you go through each and every test that you order for the patient, so that you feel confident when you do eventually talk your patient through their report. So you can see over here, this patient has got issues with detoxification, or potentially issues with detoxification, and bone health and insulin sensitivity. And this is how the report looks. So usually I would concentrate on the areas where there are three dots, and that is where I would start working with the patient. The DNA test is a lovely clue on where to start. You can see that it also has a look at the patient's lactose and gluten intolerance, whether they are should avoid those. Of course, I do recommend that they do anyway, but this is a nice way of showing a patient whether they really should listen to you. And most of the patients I've actually tested don't, they have SNPs with regards to gluten intolerance. So that is very interesting. And it also shows you on the vitamin A, D, and B12 and vitamin C, whether they have an increased need. And this is just to show the dial, and to show that this patient has an increased need genetically for the vitamin D and B12. And here is the ApoE3, E4, and the results. Just for your information, it doesn't actually say Alzheimer's on the test report, so which is better, because one doesn't want to scare the patient, especially if you are doing it for a child. It doesn't actually say that on there. So we would evaluate nutritional deficiencies. The test would be the metabolics or the NutriVal. So this tests organic acids and amino acids, and it gives us a targeted prescription for all the supplements with dosages and corrects nutritional deficiencies. This is what the test looks like, the report. And it's very helpful because it shows the patient's current status and where one needs to be working. So, for example, a patient might have an increased need for inflammation support. They might have a methylation issue. They might need mitochondrial support. So this test is amazing because it's a lovely follow-up from the DNA health, and it will then show you exactly where you need to work for the patient and also what to treat with. So it gives you a prescription on what you need to prescribe for the patient and in what kind of dosage. It's important to evaluate the zinc-copper ratio. Most patients have too little zinc and too much copper in dementia patients. So where would the copper come from? It could come from copper piping or vitamins that have copper in them. So it is possible to order multivitamins without copper. And low zinc is from poor diet or poor zinc absorption due to PPIs. And aging in Alzheimer's is associated with low zinc levels. So the type 3, the toxic types, have low zinc. And low zinc, patients with low zinc are more sensitive to other heavy metals, for example, mercury, and also to mold. The zinc affects insulin synthesis and hormone signaling, and deficiency causes autoimmune response and cellular damage and aging. The treatment, of course, would be with zinc. We need to evaluate heavy metals for the patient. So mercury and heavy metals are neurotoxic. And this can cause memory loss, insomnia, tremors, irritability, and depression. Larger, older fish could possibly contain more mercury. So that would be tuna and swordfish. And smash are the fish that one should be encouraging one patients to eat. So that would be salmon, mackerel, anchovies, sardines, and herring. Dental amalgams may contain mercury and possibly arsenic in chicken, so it's important to eat as organic as possible. Lead paint in old buildings might contain lead is found in paint in old buildings, and cadmium is found in cigarettes and certain factories' paints. The test would be the toxic metals urine test, but we do have hair analysis and blood analysis for heavy metals. And heavy metals, stool analysis for heavy metals. Heavy metals would then need to be detoxified, and chelation protocol would need to be followed. So I would refer to a chelation specialist for this. This is a sample report of the toxic metals, the urine test. And you can see anything in the red areas is of concern. We need to evaluate mycotoxins. So unfortunately, exposure to molds can cross the blood-brain barrier. So it's very important to fix the gut when one is treating a patient for mycotoxin exposure. The test that one would order is a mycotox, although we have more than this test. There are a couple of tests on our system. And then the mycotox detoxification protocol can be followed. So we've got a fantastic video under education on our VMS system. And there's a fantastic protocol that one can follow with regards to treatment of mold. This is what the test looks like. It's a very, very easy test to use. We need to evaluate the patient homocysteine levels and assess methylation. So homocysteine is a fantastic test to use as it's a marker of inflammation and suboptimal nutrition. It develops from eating foods rich in methionine. This would be nuts, beef, lamb, cheese, turkey, pork, fish, shellfish, soy, eggs, dairy, and beans. Methionine converts to homocysteine, then converts back to methionine and cysteine. And this process requires B6, B12, and folate. Some patients have an increased need for B6, B12, and folate, which would come up in the DNA health. We need to recycle the homocysteine, or it damages the blood vessels and the brain. So our homocysteine level, you'd like it to be around 6. The tests that we have on our system are the methylation profile, the DNA health, metabolimics, Nutribel, and cardiometabolic profile. And then treatments, B6, B12, and folate methylated. Then we need to evaluate the hormones of the patient. So hormones are important as they contribute to cognition by supporting synapse formation and maintenance. So the thyroid is very important to evaluate how the thyroid is functioning. You can encourage the patient to take the basal temperature first thing in the morning in the armpit for 10 minutes, and lower than 36.5 is too low and they may have a low thyroid function. So they actually need to keep the thermometer next to their bed, not get out of bed. First thing they do is take their temperature before they get up. This can result in low metabolism, in slower reflexes, slower heart rates, and slower mental sharpness. So one needs to test for free T3, free T4, reverse T3, and T3 and TSH. The TSH may be normal, but T3 may be low. One of my favorite tests on our system is the comprehensive thyroid assessment, because it also includes the reverse T3, but we have a lot of thyroid tests available. And then we've got fantastic thyroid complexes. We do have a lot of supplements on our system. What is nice is that you can order everything for the patient and from different brands, and it gets shipped in one parcel to the patient's home. So that is very, very helpful. And there are some amazing thyroid complexes on our system. This is what the comprehensive thyroid assessment sample report looks like. And you can see that the reverse T3 over here is tested. Then we need to be looking at estrogen and progesterone, because this is crucial to prevent dementia. So women who have ovaries removed by age 14 do not receive HRT at double risk of Alzheimer's. It's important to look at the ratio of progesterone and estrogen. And testosterone supports the survival of neurons. Important to look at cortisol, pregnenolone, and DHEA. The stress is a huge contributor to cognitive decline. Stress activates the HPA axis. The adrenals secrete cortisol, and high levels damage neurons, especially of the hippocampus. The chronic stress can cause dysfunction of the HPA axis, and then the patient won't produce enough hormones to deal with stress and infections and cause lack of sleep. And this all exacerbates cognitive decline. A rapid reduction in cortisol causes loss of neurons as well. The pregnenolone, estradiol, testosterone, cortisol, and DHEA are important to evaluate their levels. Pregnenolone is siphoned off in stressful times to make stress hormones, and too little of the stress hormones are produced. Pregnenolone supports memory and is neuroprotective. So the treatment would be using herbals or bioidentical HRT. So it's important to treat upstream. Look at the pathways, look at the steroid pathways chart, and treat that. So don't just replace the hormone, have a look at the upstream. And one needs to look at hormones in relation to each other. We need to look at how the hormones are functioning in the body. So this is our Dutch test. And one is able then, with the help of the Dutch test, to restore hormonal imbalances, and with the help of HRT, natural or bioidentical. So this is what the Dutch test looks like. You can see that it shows the ratio of 3 major hormones, which cannot be done on a blood test. So this is really, really helpful. And it also shows you the cortisol pattern, and it shows you the total DHEA production. What is also important about this test is that it can show us whether the patient is detoxifying the estrogens, which is essential, especially if the patient is going to be put onto any form of HRT, and also if there's a family history of breast cancer. And this is the also on the Dutch test. It shows us the free cortisol pattern and the free cortisone pattern. We also need to evaluate cholesterol. So many patients with high cholesterol have no vascular disease, and many with low cholesterol do. This is quite interesting. A vascular disease can cause Alzheimer's. In vascular dementia, it results in many small strokes. So cholesterol must also not be too low, because that can cause brain atrophy. Damaged cholesterol is a problem. So one needs to measure oxidized LDL, small dense LDL, and LDL particle number, LDLP. The cardiometabolic profile is the test of choice. And Debbie showed you this just now. What is lovely about this test is that it tests the homocysteine as well, and it tests insulin and glucose. So this is a really worthwhile test to look at, and very easy to use this report. We need to evaluate the D3. The D3 enters the cell and binds to a D3 receptor, allowing D3 to enter the nucleus, and this turns on over 900 genes. D3 affects bone metabolism, suppresses tumor formation, reduces inflammation, and creates and maintains synapses. So we want to be aiming for about 50 to 80 on a blood test. I like my patient to be around 70. And the test of choice is the vitamin D blood spot. This is what it looks like. It's just a finger prick test. What is absolutely essential is to evaluate gastrointestinal permeability. So whether a patient is suffering from leaky gut. So the cells lining the gut form tight junctions, and this keeps the food inside the gut. If the gut becomes leaky due to gluten sensitivity, chemicals, pesticides, preservatives, sugar, alcohol, inflammation, stress, the presence of yeast, medications, for example, aspirin, then larger particles can fit through, and then they are seen as a foreign agent, and then this results in an autoimmune response. The chronic inflammation can cause Alzheimer's. I like the GI map of zonulin. Zonulin tells us a lot about leaky guts and gut permeability. This can be ordered as an add-on. Zonulin can be ordered as an add-on for most of our other blood tests, stool tests. This is what the GI map looks like. I really love this test, and it's so easy to use the report. It will tell us about pathogenic bacteria, parasites, worms, opportunistic bacteria, fungi, yeast, viruses, parasites, and then it tells us a lot about intestinal health. So elastase, whether the pancreas is functioning well, tells us about the liver functioning, whether there's occult blood, about inflammation, and also test calprotectin, and I usually add on the zonulin. So it's really important to evaluate the blood-brain permeability. So of course, we're looking at the gut. And once the gut is fixed, it definitely stands patient in good stead, because if the blood-brain barrier is permeable, then bacteria, fungi, and viruses can actually reach the brains. And they actually found that in autopsies of Alzheimer's patients, many of them had bacteria, fungi, and viruses in the brain. So herpes simplex virus is a problem, and also the gingivalis bacteria can actually migrate up to the brain. Syphilis is a problem, and so it's important to ask this in the family, in the history of the patient, whether they have actually had oral infections, whether they've had herpes simplex, if they've had syphilis, and then also it's important to ask them about tick bites, and we can assess fungal infection through the stool, and which all cause inflammation. And so I quite like the GI map, as I mentioned, and we can check for viruses, we can test for viruses, and we can do the Tick Fix Plus to check for Borrelia. We need to evaluate mitochondrial function. The test of choice would be the organic acids test, the metabolomics, or the Nutrival. And chemicals damage the mitochondria, as well as antibiotics, statins, alcohol, L-DOPA, antifungals, non-steroidal anti-inflammatory drugs, other drugs, and antivirals. And of course, we need to look at the ApoE4 status. So now we get to the last part of our talk, and this is how to reverse a cognitive decline. So you've done you've taken the history from the patient, you've examined them, you sent for some tests, and now you need to know what to do. You need to advise the patient on diet and lifestyle, identify their problems and fix them. It's important to go beyond normal values on blood tests, so go for optimal levels, address all the abnormalities. You've got to plug all those holes. Each patient is different, so it is not as simple as just putting them onto something that's supposedly good for the brain, because each patient has got a different cause. And with these patients, most of the time when they come into your practice, it won't be mild cognitive impairment. It will already have gone beyond that. So it's important to really do it as fast as you can, but you need to do it in phases. So drugs should be the last resort. And as I mentioned, the drugs don't really work and for very long. So start, if possible, in the subjective cognitive impairment stage. So if a patient says to you, they're in their 50s and they're struggling to remember people's name, but doesn't matter, it's part of getting older, tell them, no, it's not. And it's important to actually start then by putting them on the right supplementation, sorting out their diet and lifestyle, and putting them onto a couple of things of supplements, because once you're treating later on, it's more difficult to reverse, and they also need to be taking more. So first you will heal the gut. Healing the gut will reduce inflammation and aid absorption. It will reduce infection, improve the immune system, and aid optimal microbiome and aid hormonal balance. So I get for my patients to remove gluten, dairy, sugar, artificial sweeteners, preservatives, anything with dyes, pesticides, and genetically modified foods. Also get them to remove alcohol, antibiotics, non-steroidal anti-inflammatory drugs, manage their stress levels, and follow the 5R protocol and restore dysbiosis. So this 5R protocol is what I follow for my patients. I don't always do it step by step, and sometimes I will do more than one step at a time. I will just show you the next, I'm not actually sure how to get, oh yes, okay. I'm just going to show you this slide. This comes out of the GI Map Interpretive Guide. It is a fantastic guide, a 31 or 32 page guide on how to approach the stool test and how to actually treat the patient. So I highly recommend you print that guide and have it on your desk, and maybe laminate this particular page. This is really helpful, the step-by-step guide on how to treat the patient and how to take them through that 5R protocol. So this is the 5R protocol. You're going to be removing, replacing, re-inoculating, repairing, and rebalancing. So what do? You remove the infection with an antimicrobial, an antifungal, antiviral, and an antiparasitic. You might be using oil of oregano, berberine, caprylic acid, garlic, uva-ursi, olive leaf, black walnut, artemisia, echinacea. If you're looking at some of like the CSAP, that actually the stool test, it actually shows you what the patient will benefit from using. Otherwise, if you're doing the GI map, you would be, or the GI360, different tests. Some of them will show what the patient is sensitive and others don't, but you can't really go wrong with using these. And on our system, we do stock all of them, and some of them in combination, which is quite nice to use a broad spectrum. Then once you've removed the infection, you would replace. So you would look at some digestive support with betaine hydrochloride. If there's a low stomach acid, you might use herbal bitters, apple cider vinegar, and digestive enzymes. Very important to look at that. And then re-inoculation with pre and probiotics. One can also get that from fermented food, and prebiotics from fiber-rich food, onions, leeks, and garlic. We've got fantastic probiotics on our system as well. Then you would be looking at repair. So you want to actually heal the leaky gut with some L-glutamine or slippery elm, and giving bone broth to the patient every day. And then rebalancing where you would be looking at supporting the patient with sleep, the correct diet, stress, and exercise. And I usually like to retest, do a follow-up stool test after about 3 months. Then with regards to diet, you're looking at a low glycemic diet, encouraging patient to eat whole foods, eating the rainbow, making smoothies with spinach or kale. Maybe you want to add some spirulina to that. Eating fruits which are low GI, for example, berries, lemons, limes, tomato, avo. Encourage them not to have refined carbohydrates or saturated fats. Eating high fiber diet, avoiding gluten and dairy, and reducing toxins and preservatives. This is a chart that I give to every single patient, and it's a phytonutrient spectrum foods. So I encourage them to eat 9 to 13 servings of mostly vegetables a day and some fruits, of course, and that they eat something of every color every day. I also encourage them to eat variety. So for example, if they're eating 2 of the red on a Monday, Tuesday, then I encourage them to eat 2 different red items on a Wednesday, Thursday, so that they don't eat the same foods all the time. What I do is I encourage them to stick this onto their fridge and then just circle what they like, and then that helps them with the shopping list. It encourages them to consider different options of what to eat. And some of my patients say, oh, but it's so difficult to eat 13 servings of vegetables and some fruits a day. And I say to them, it isn't actually difficult, because they can make a smoothie with blueberries, strawberries, spinach, avocado. In the morning, that's already 4 or 5 items. And then for lunch, they can have a huge salad with lettuce and something white, tan, or brown would be some mushrooms. And they could have tomatoes and some garlic, some avocado. So they can make a colorful salad, and already they can put 7 different colors into a salad. And then at nighttime, they only need 2 or 3 vegetables. So it's not that difficult to eat the rainbow. I encourage my patient to eat detoxifying plants, so cruciferous and allium vegetables. And then also artichokes, beets, dandelion, ginger, grapefruit, lemons, olive oil, seaweed, and greens. To consume good fats, MCT oil is very helpful, and eating avo, seeds, olive oil, and fish. Eating less meat and taking probiotics and prebiotics in food form is absolutely fine. And then not to damage food when cooking. I encourage them to manage the homocysteine levels by eating foods rich in B12, B6, and folate, and limiting nuts, beef, lamb, cheese, turkey, certain fish, some shellfish, soy, eggs, dairy, and beans, and checking every 3 months. So this is if they have problems with their homocysteine levels. And then also managing insulin levels with diets, exercise, sleep, and managing stress. So this is the KetoFlex diet, which is recommended by Dale Bredesen. And he said that ketosis is really helpful with regards to the dementia and Alzheimer's patients. The ketosis is the process in which the liver produces specific chemicals called ketone bodies by breaking down fats. This occurs when running low on carbohydrates, which is our first source of energy. Mild ketosis is optimal for cognitive function and produces BDNF. So low carbohydrate diet and moderate exercise, 150 minutes a week, and fasting for 12 hours or more. Consuming MCT oil and eating a lot of unsaturated fats, for example, olive oil, avocado, and some nuts, they can promote ketosis. Then the metabolism becomes fat burning and cells become insulin sensitive. MCT oil helps with cravings and fatigue. So 1 teaspoon a day would be the dosage. And then the flex stands for flexitarian. So we encourage a patient to eat a largely plant-based diet, and emphasis is on vegetables, especially non-starchy vegetables. We encourage them to eat uncooked, uncooked, and cooked vegetables and eating many colors, eating the rainbow, eating fish and poultry, and meat as a condiment, red meat as a condiment. 1 gram of protein per kilogram of body weight a day, and the quality is really important. The 12-3 stands for 12 hours between dinner and breakfast. An ApoE4 patient with the ApoE4 SNPs should fast for 14 to 16 hours. And then 3 hours is a minimum time between dinner and bedtime, so to eat earlier. Otherwise, we may find inhibition of melatonin and growth hormone. And then what will happen is that autophagy will be stimulated and mitochondrial damage will be eliminated. So this is definitely the diet to follow. And then we also encourage the patients to have breakfast with hot water and lemon, which stimulates the liver and provides vitamin C. The Ketoflex diet also prevents leaky gut and optimizes the microbiome. And Dale said that we should encourage patients to avoid gluten and dairy. Exercise is really important. One can balance blood glucose with berberine, it's 500 milligrams 3 times a day. And exercise, as Debbie mentioned, aerobic and weight training 4 to 5 times a week for 45 to 60 minutes. These patients actually need to exercise quite a lot. This reduces insulin resistance, increases ketosis, supports brain-derived neurotropic factor, increases the size of the hippocampus, improves vascular function, reduces stress, lowers inflammation, improves sleep, increases the survival of neuron, and improves mood. Sleep, very important to address sleep apnea. Encourage a patient to sleep for 8 hours at night and look at sleep hygiene. So encourage them to stop with screen time from 5 o'clock at night, to go to bed in a dark room, and also not to be exposed to too much bright light after 7 o'clock, not to go to bed too late, to be calm in the evening and to wind down, and rather exercise in the morning, have an early supper and go to bed hydrated. So you don't want the patient waking up in the night thirsty. Melatonin peaks at 9 o'clock at night. So we should encourage these patients to actually go to bed when the melatonin is peaking and not to be on their cell phones, on the computer screens, or watching television at night. If I do prescribe melatonin for my patients, I usually give it to them at 9 o'clock at night. Melatonin is the most incredible antioxidant, and I've done a lot of work with Dr. Jesus Devisto, who has a neurocognitive clinic in Spain. And we've treated a lot of traumatic brain injury patients, and we've actually gone right up to 100 milligrams of melatonin per night for patients. For the first week or two, they're a little bit sleepy during the day, and then they actually don't have any side effects. Melatonin is very, very safe to use. For dementia patients, I would probably be looking at between 5 and 20 milligrams at night. It's important to address the causes of insomnia. So if we look at menopause, anxiety, depression, reflux, and then treat with melatonin, 5-HTP, rhodiola, balancing hormones, and fixing leaky gut with the 5 R's. Stress is something very important to consider, and cortisol is toxic to the brain, especially for the type 3, the toxic types. So Alzheimer's often coincides with a long period of great stress. So you can encourage your patient to do yoga, meditation, breathing, exercise, go for massages, listen to music, or even play a musical instrument, which is fantastic for brain health. Reducing caffeine and alcohol consumption, and this all helps to prevent atrophy of the hippocampus. Brain training is important, so patient can do computer exercises. There are a couple of good ones available: Luminosity, Cogstate, Posit Science, and DACM. And playing games, so board games, Scrabble, chess, word searches, and doing puzzles. And then, of course, socializing is essential. So I've already covered the hormonal balance. I think I'm going to skip through some of this, and I've spoken about the heavy metals. So just a recap on some of the tests there, you want to focus on balancing insulin levels, focus on sorting out inflammation and infections, balancing hormones and sorting out hormonal deficiencies, and with the correct nutrients, nutritional deficiencies as well. And we would like to restore those lost synapses. The tests to consider quite a few, the ApoE3, which is in the DNA health, inflammation, you could look at DNA health, metabolomics, Nutrival, the cardiometabolic profile, homocysteine levels or methylation, you would be looking at the Nutrival or the metabolomics, or the methylation profile. B12, B6, and folate deficiency, very important to have a look at that. Vitamin C, D, and E deficiency, fasting insulin, glucose, HB and HbA1c. You need to look at cholesterol levels, glutathione, the need for glutathione. We look at the Dutch test for hormones. We can do a thyroid panel, looking at stool tests, for example, the GI map, and toxic metals. And then investigations, you would be looking at the marker, the test that you'd have in your practice, and then maybe sending patient for the MRI. Or perhaps you need to refer to the geriatrician to do that for you. So the basic plan is to follow the KetoFlex 12-3, exercising, sleeping well, managing stress, brain training, and socializing. Supplementation, this is of course different for every single patient. Debbie's gone into supplementation for all the different types of Alzheimer's, so I won't go into all of it, but we do stock all the supplements on our site, and you can have a look at those if you just search for the ingredients. Some of them are available in complexes, but every patient is different, so each patient will get different supplementation, and this is what functional medicine is all about. So to summarize, it's really important to treat these patients as early as possible. You want to treat them for at least 6 months. You need to identify what's wrong. Don't treat blindly. You need to test. We cannot assume we know what was going on. Keep optimizing. So don't keep the patient on the same supplements. You keep changing them. You keep on working. You unpeel that onion. And do the test 6 monthly to make sure that you actually are winning with the patient and that they are improving. Adjust the plan. Stick with the plan. Make sure that the patient is actually doing what you have recommended. And then just some tips, join Facebook groups. There are so many groups available where you can get help on the functional medicine groups. We as Nordic have a group, and there are courses you can do on dementia. Follow the functional medicine doctors on Facebook and websites. Google different protocols. Have a look at Dr. Dale Bredeson's site. Deanna Minnick, she's a nutritionist. She's got some amazing ideas. And then on the various Facebook groups, search for dementias and start looking at case studies and seeing what they're actually doing with regards to testing and treatments. They give fantastic advice on these groups. Join WhatsApp groups, speak to your colleagues, ask them for help. Those who have treated dementias, ask them. Read as many books as you can and don't be afraid. Start treating, because you've got to start somewhere. Everybody started somewhere, so don't be afraid. And this is goodbye from us. And this is another photograph that I took when visiting Debbie in Nature's Valley. Those are our children there in the water. And wishing you all a fantastic evening. These are our contact details. So if you would like to WhatsApp us a question or email us, please don't hesitate to do so. We are here to help you. If you want to brainstorm a case, please feel free to book a call with us, send us an email. We can help you brainstorm cases, choose tests for your patients, and we can also go through the reports with you once you've got those results back. So we are here to support you with all of that with regards to tests and also supplementation. And we hope that you've enjoyed the talk and that you've learned something tonight.
Thank you, Debbie, and thank you, Rene. There's been lots of activity in the chat box. I think some people have replied some of the questions, but I think you've covered so much that going through specific questions on some of the heavy metals and other like infections is nearly too much at this time after a nearly 2-hour presentation. It looks like everyone got a lot out of it, and they seem to be very content. So we will of course share the recording with you all, so you can revisit some of the pearls that Debbie and Rene has shared with us. So thank you very much, both of you. I don't know, I can't see you. Oh, there you are, Debbie. You're muted. Thank you to you all for hanging in there, and thank you for an excellent presentation.
Thank you. Thank you so much, everybody. Thanks, Anne-Catherine, for the wonderful opportunity.
Have a good evening.
Good evening. Bye.
If you do not already have an account with us, please contact our team and we will assist you. If you found this webinar helpful, please like and subscribe to our channel.